Hello, I'm Rohit Shetty. I'm a consultant spinal surgeon, and I'm working for HCA UK, and I do my clinics at Princess Grace Hospital and Wellington, and I do the operating sessions at Wellington Hospital in Northwest London. I think when we all generally speak about spinal surgery, there's a certain amount of anxiety and fear related to things like the heart, the spine, and the brain. And along with that comes the challenges of dealing with not just the complexity of the condition, but also the reassurance our patients need in terms of being looked after and taking them through that decision-making process. I was fortunate enough to be trained by very good spinal surgeons within the UK and also internationally, where I did my fellowship in Switzerland. And having looked at them, and I thought I found it really fascinating in terms of the complexity of the work they did, but the calmness and the approach they had towards dealing with patients. I was obviously quite biased with them, but then through the job, having been trained as an orthopedic surgeon and then subspecializing into spinal surgery, I felt that the challenges which are there within the subspecialty interest which I have really motivated me to take on spinal surgery. It's taking through patients, because I think when most of our patients or individuals are referred to see a spinal surgeon, I think the first thing which comes to their mind is that he's a surgeon, he's going to operate on me. And actually, it's only 10% of our patients who require an operation. 90% of patients don't need an operation for spinal conditions unless we are dealing with any sinister pathology. And I think the most rewarding bit is to take them through the entire journey of giving them options. I think more importantly, what is more challenging, and from what we discussed earlier about what made me do that, is there's a set group of conditions which commonly affects individuals, especially adults, which is within my practice. And it's about bespoking that treatment to an individual. So in a particular clinic, I might see 10 people who have got a similar looking scan with similar symptoms. But actually, when I reflect back on the day, I just come out thinking for all 10 of them, I have given 10 different options to decide what's best for them. So it's about bespoking it to an individual, making sure it's the right approach for them, but also a two-way conversation when you see them, is to saying what works best for them, guiding through my expertise, but also listening to them and making them understand about their condition as to what we can achieve in the short term and what are the implications of what we do now in the long term. And I think that coming out of that and discussing with individuals on either situations when they come back, and when we come to the end of the journey in terms of treating them, is to get that reflective feedback and taking them through. As doctors, it's about being open, it's about being transparent, but also more importantly, when sometimes we don't get it right, is to also have that conversation and saying our rationale and thought process of going through what we did was in the best interest, and having that open and mutual conversation. So I think I find that quite rewarding when people come back and saying yes, you let me decide what was best for me. I had time to think about my options in most cases if it's electively planned stuff, but also having that mutual respect about the decision-making process on both sides. Because sometimes people come and saying, I was told I need an operation. In my opinion, sometimes it might not be in the best interest, because if you look at the risk-benefit ratio, the risk might outweigh the benefit. So it's about bespoking to an individual out there. And I think that's been the most rewarding bit about the challenges which I've faced, not just from an operating point of view, but it's that decision-making process to guide someone through their journey of getting better before an intervention, and possibly if an intervention is required after that. I've been told that I'm a very patient man, and I think it comes partly from your job and from what you learn from your patients, because that's what we get taught on the first day of medical school, is that listen to people. That's what we do, and then you're running through a very might be a busy clinic, but it's about giving people time. So what they can expect is that they can expect a first time to be able to tell me what they have been through, what sometimes also understanding what their perception is, because everyone is really anxious coming in to see a doctor, whether you're going in them to see for a chest infection or whether it's for your back or whether it's for a headache, and that's what I tell my juniors. I say, listen, for me and you, waking up every morning and going to a hospital is just a normal experience. But for a significant proportion of the population, going into an hospital, in some cases, yes, when they get better, but it's generally a very sort of nerve-wracking, anxious situation. So I think for me, what's more important is an understanding that when people come to you, there's anxiety, there are some perceptions about what they've been told, about giving them time. And I think what you can expect from me when you come and see me is an understanding that it is okay to be nervous. It is normal to have that perception, and then we go through the journey of how we can discuss options and see how we can make that individual better.